Good afternoon, everyone, and welcome to the HIV and Healthy Hearts webinar. I'm Destiny, the media strategist for Seeds of Healing. Seeds of Healing is an HIV awareness and advocacy organization whose mission is to deconstruct myths that perpetuate HIV stigma. Our work seeks to eliminate disparities for Black women living with HIV. This webinar is being recorded and will be shared on our SOH Time platform, as well as posted to our YouTube channel for you to share with others or come back and watch for yourself. Attendees are able to drop questions in the chat box and will be shared at the end of the webinar, but feel free to ask any questions or write any comments throughout the entire program. So before the webinar begins, please welcome our panelists today. We have Dr. Shemika Martin, who recently started her family medicine residency in Wilmington. She grew up in a military family, is originally from Aberdeen, Maryland. She attended undergrad at Towson University in Maryland, where she received her BS in cell and molecular biology. And after college, she spent some time volunteering at free clinics in Baltimore before deciding to go to medical school. She then attended medical school at Ross University and completed clinical rotations in New York City. She chose family medicine because she wanted to be able to treat patients of all ages and build a professional relationship with all of her patients. Her interests in medicine include preventative medicine, women's health, and global health. Outside of medicine, she enjoys cooking, reading fiction novels, and traveling to new places. We have Masonia Traylor, who is a mother of two, an HIV/AIDS activist, and a certified speaker. She is a founder and executive director of the nonprofit organization Ladybird Andy Inc., servicing women and youth impacted by HIV. With her expertise in trauma experiences and perinatal transmission and advocacy, she leverages her capacity coaching through Legacy Leadership Consulting Firm to help leaders and grassroots organizations participate in organizational development and change. Masonia has had magazine features on the cover of People and Positively Aware in Time and Essence and in campaigns across the globe. She serves as an ambassador for Positive, Heather Ivey, CDC's Stop HIV Together, and Kaiser's Greater Than AIDS. And she's a global blogger for the Well Project, second vice chair of the Metro Atlanta Ryan White Planning Council, and a member of Positive Women's Network and the National Council for Negro Women Executive Health Committee. Finally, we have Stacy Jennings-Senghor, who is a longtime survivor of HIV. She has been living with HIV for 27 years, and she feels that healing is vital as she lives her life to the fullest each and every day. She believes that no matter what life throws her way, she is able to overcome it, and states that there is nothing God has brought her to that he won't bring her through. And without further ado, I will turn it over to our panelists.
Thank you, Destiny. I'm Dr. Martin. Today, I wanted to discuss about heart disease. Now, heart disease is a term that is used interchangeably with cardiovascular disease. Cardiovascular disease is the leading cause of death in America today. It refers to a variety of disorders that not only affect the heart, but also the blood vessels that run throughout our entire body. The top 4 disorders that are included in this term include hypertension, which is an increased blood pressure in those blood vessels, coronary heart disease, which is cholesterol buildup in the blood vessels that supply the heart. And when there is a complete blockage of that, that can lead to a heart attack. Heart failure is when the heart is unable to pump blood as effectively as it should to the rest of your body. And lastly, stroke, which is a blockage of the blood vessels that supply your brain. And this can also be due to a buildup of cholesterol. So what contributes to cardiovascular disease? We have the traditional risk factors that are seen in the general population, such as tobacco use, decreased physical activity, obesity, and conditions such as hypertension, diabetes, and metabolic syndrome. In addition to those traditional risk factors, we also have HIV and antiretroviral therapy that have a direct and indirect effect on cardiovascular disease risk. These conditions can affect our metabolism, our hormone production, and even our immune system, and overall leading to an increased likelihood of cholesterol buildup in our blood vessels. There are other factors that can play a part, such as gender. Females are more likely than males to get cardiovascular disease. Race, African Americans are more prevalent than Caucasians to get cardiovascular disease. Increased risk, depression, having a family history of cardiovascular disease, and even unknown factors that we're still researching today. So what this means is that African American women living with HIV have a 2 times greater risk for cardiovascular disease than African American males, Caucasians, and even Hispanics, regardless of their HIV status. So when someone says that they've had a heart attack, what are the common symptoms that we're looking for? Men have been known to have more of the classical symptoms of the chest pain that radiates to their jaw or even down one arm, while females have been known to have some of the classical symptoms, but also indigestion, back pain in between their shoulder blades, or just overall tiredness. For stroke, it's important to remember the mnemonic, be fast. Stroke can present as just feeling lightheaded, feeling off balanced, having blurry vision, having facial weakness on one side that causes a facial droop, having arm or leg weakness, usually on one side of the body, and then lastly, having difficulty with speaking. If you ever have any of these symptoms, it's important to call 911. With heart attacks and strokes, it's important about the time when your symptoms started because of the effective treatments that need to be given in a timely manner and in order to prevent long-term damage. Now, Stacy, will you be able to share with us your recollection of your cardiovascular event?
4 years ago, almost 4 years ago, June 10th, I can remember it like it was yesterday. I woke up in the middle of the morning, about 4:30, and I was having these weird pains in the right side of my chest. And I had these pains that went down my right arm, which is not typical heart attack symptoms, because it usually, they say it goes down your left arm, you sweat. And so I brushed it off. So about an hour and a half, I was still having these pains. So I pull out my phone and I Googled the symptoms. And it said it may be just, I may have slept wrong. So it said to roll up a pillow and put it behind my neck and lie there for about 5 to 10 minutes. So I did that. And it didn't help. And so I woke up my partner at the time and I said, you know what, something's not right. Normally I'll just lay down and just relax for the day. And I told him, I said, something's not right. And he says, well, your chest is always hurting. I said, trust me, something's not right. I need to go to the hospital. So I went to the hospital, which was about 5 minutes up the street from where I live. And I get in the hospital, could hardly breathe, and bent over in a wheelchair. And they said, oh, well, we'll get you back. We're used to you coming in here. So, because I would go in there for chest pains because I have acid reflux. And so they brushed it off. So after about 30 minutes, they brought me to the back and they attempted to do an EKG. They could not, the guy that was doing the EKG or the nurse could not get the leads to act right. So they used an old EKG that showed that it was normal. And so they put me took me onto the back and had me lie down on a bed. And the doctor comes in and he presses my chest. He said, does that hurt? I said, yeah, it's kind of sore. He said, oh, it's not your heart, it's musculoskeletal. And he walks out of the room. And he tells the nurse, give her some aspirin and things of that nature, just to be on the safe side. And so I lied there again for another hour and a half to 2 hours. And I was still in pain. So they brought me more aspirin. This time they gave me propofol. And I'm like, okay, they really think it's not my heart. And so they finally said, well, we're going to do some blood work. So they did my cardiac enzymes, and the nurse comes back and she looked like a ghost. And she says, oh, we're going to have to get you to another hospital that can take care of you because we can't take care of you here. I said, what's going on? She said, well, your heart numbers are elevated. I said, what does that mean? They had already seen that I was having a heart attack. After about four to 5 hours, I've been sitting there thinking it was just musculoskeletal pain. And she says, well, we're just going to send you to a heart hospital so they can find out what's going on. And so by the time the ambulance got there and they took me to another hospital, 15, 20 minutes away, mind you, the damage is continuing to happen. And by the time I got to the other hospital, which is a heart hospital, they specialize in heart care. They took me up to the hospital floor, the heart floor. And they said, the doctor comes in, he said, we'll be back tomorrow afternoon, to get you in the cath lab to try to figure out what's going on. He said, but wait a minute, he said, you don't look good. And so I wasn't having any pain because they had doped me up with so many different things. And so before he could even get all of the leads on my chest, he said, STEMI, ma'am, you're having a heart attack. And they rushed me out to do an emergency procedure. So I had to have a stent. I had 100% blockage. I had a heart attack, what's known as a widowmaker, which most people don't make. I often get very, very emotional during this time because I go through so much. But they did not think enough of me to do what they needed to do. And I almost lost my life. So I'm here today to let others know you got to pay attention to your bodies because the healthcare system, they're just so lax in everything that they do. And so I was in intensive care. I already have diabetes. I have hypertension. I have high cholesterol. I've been HIV positive at that time for 25 years. And still, they did not care. And so I got out of the hospital. I had another blockage, but they could not because I ended up getting a blood clot in my left arteria descending on the left part of my heart, which is the biggest part of the heart. So I ended up getting a blood clot and they had to put me on blood thinners. So upon putting me on blood thinners, I was losing blood every month around my menstrual cycle. And so I was having to go in the hospital to get several blood transfusions every month. And it was draining me. And so, I asked them, what can y'all do? What's going on? And I can remember my mother asking the doctor, is she going to be all right? He said, ma'am, he said, your daughter really shouldn't be here. He said, I can't answer that, but all I can do is tell you to pray. And so I'm here before you today, almost 4 years later. June the 10th will be 4 years. And I suffer every day, not just physically, and having to be careful with my heart and take care of the diabetes and my HIV and juggling all those different things. I have to make sure my mind is clear, but it's not easy. But I try every day to be the best that I can be despite of and because of. Thank you.
Thank you, Stacy. Thank you so much. Masonia, would you be able to kind of share with us your recollection of your event?
Yeah, after Stacy's, definitely parallel. So I experienced a heart attack. It'll be 4 years, April 2nd. And some of the things leading up to the heart attack that I did not recognize as symptoms, but more or less I learned later were signs. I was having night sweats for a couple of weeks, and I would have moments where I was thinking I was having an asthma attack, or that the pollen count was really high. But the morning of my event, I got up to take a shower. But right before I got up, when I sat up in the bed, I felt something like it felt like a sharp stab for a moment, and like 2 small hiccups and a little bit of heartburn. I said, that's weird. And I don't get hiccups like that anymore. So that kind of threw me for a loop. But I took a shower, but everything was like kind of real mellow that whole day. That morning. So I went to class. I was taking statistics at the time. And when I got to class, I had a couple more of those hiccups, and it was kind of weird. But I said, I think maybe I need to see a pulmonologist because this is my lungs. Like I'm struggling to breathe because the pollen count is up. My asthma is getting worse. I live in the city, so maybe that's what's going on. Well, when I walked back from class, I got in the car and I was headed to see my boyfriend. And I got on the highway. 7585 in Atlanta is our largest connector. And I realized I had passed the exit that I needed to get off of, which was weird at first. And I said, well, I could just get off at the next exit. But I was on the phone with a friend of mine, and we had just got the Bluetooth laws passed where you had to have on a Bluetooth hands-free here in Georgia. And I just asked her, how do you know when you're having a stroke? And she starts to explain it. And she's like, wait, what's the matter? Why would you ask me that? I said, well, how do you know when you're having a stroke? And she said, no, I'm saying, why are you asking? And then she had repeated herself, but then my forefinger and my thumb, I kept telling her, sometimes I'm getting a little numbness in my fingers. I'm just wondering. And she goes down the list real quick. And then as she's going down the list, I start hyperventilating. And at least that's what I'm thinking. I'm hyperventilating on the highway. And there's an extreme pain going from my finger and my pointy finger and my thumb radiating up my right arm. And I'm thinking I'm hyperventilating. I'm thinking I'm having a panic attack. And my friend says, strokes don't hurt, Masonia, pull over. So I said, okay. But as I'm trying to say, okay, my heart is pumping really, 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 really fast. And I'm trying to get off the highway, but I'm also starting to faint. So I managed to get off the highway. And because I knew where I was, I just had to do some quick thinking. I do a U-turn because I figured if I park where I was, traffic is going to get backed up. And I'm about to hit somebody's car because I can't stop yet. So I do a U-turn when I get off the exit, and I park at a local gas station. And once I park, she says, okay, now that you park, call 911. When I get off the phone with her to call 911, I'm like, no, I'm just having a panic attack. Let me just try to breathe and slow my breathing down. But then it dawned on me, she's right. My arm should not be hurting. It should not feel like it's on fire. So I call 911, and they're asking me my name, my address. They're asking me where am I at. And I find myself repeating myself too many times, not realizing they're just trying to keep me alert. But they when the paramedics came, when they got there, I told them I'm not sure if I'm having a panic attack or a heart attack, but something is not right. And they're kind of like taking their time and assessing me. And I'm getting frustrated because I'm telling them I think I'm having a heart attack. So and eventually I get tired of them talking, and I tried using my inhaler, it didn't work. I done scared the dispatcher by telling her I feel like I'm dying, and I'm trying to breathe, but I'm like sipping air. And the paramedics that came were 2 white guys, and I was just like, they're not going to hear me the same. So I just got out the car. I started grabbing my stuff and started locking the door. And I just walked to the ambulance. I started walking to the ambulance. They pulled out a stretcher and I got on it. And from there, they asked me which hospital did I want to go to. And I was very confused about that, but I'm like, if I'm about to die, y'all need to take me to Grady, which is our #1 trauma hospital here in Georgia, right? So they get me to Grady. And I think at this point, I've been experiencing a heart attack for at least 30 minutes. And while we're on the way there, I'm asking the paramedics can you call my boyfriend? Can you call my mom? The kids are at home at spring break. And he's like, no, we're not allowed to call anyone. I said, oh, I'm about to die. Nobody's going to know. So I tried texting my boyfriend and tell him, hey, I think I'm having a stroke. I'm headed to Grady. And so the EKG monitor starts to scream because it's interfering with the Bluetooth that I'm on, because my boyfriend calls me right away. I'm trying to spell my name. I'm spelling my name incorrectly. We get there to the hospital and the paramedics, they're repeating again. We got a call about a young lady who's having a panic attack. I yell at them and I say, I don't know if I'm having a panic attack. I think I'm having a heart attack. And I repeat it at least twice. And by this time, they're like, ma'am, can you take your clothes off? Can you do this and that? And I'm like, I can't move my arm. I can't move my hands. I cannot move. I can't breathe. I do remember grabbing on the nurse and pulling her to me, begging her to help me. Poor lady. But from there, they did the testing on the troponin levels. They cut my clothes off. They say, you know, one of the two things, you make sure you wear clean drawers, and your hair should be done, but it was hat day. So that was one thing that I was like, okay. But they cut my clothes off and they immediately rushed me to the cath lab. And when they rushed me to the cath lab, they did surgery immediately and they gave me a stent. What we learned from that stent, well, they had a choice. They could either put me on life support and allow my tear to heal on its own after a couple of days, or they would go through my groin or my wrist to put a stent in. And the presiding doctor decided to do the stent. And during the surgery, I had started waking up because I don't do that well with anesthesia. And as I'm starting to wake up, I'm crying the whole time. So it's like I'm in a twilight. And I'm asking the surgical technician, can she scratch my nose? Because my nose was itching. But of course it was all slurred and she just did this. And I'm like rolling my eyes like she didn't even get the spot. But from there, once I ended up in the room in the ICU room after an hours long surgery, they came in, they looked at me spooked out. They asked me had I had any history using drugs. They asked me am I a smoker? They asked me all these questions and I'm just like, none of that. And at Grady Hospital, they used to rule you out of having a heart attack as the first rule of thumb if you're under the age of 50. And I was 32 at the time. So when they came in, maybe some hours later, they explained to me that I had, they're not sure what happened at first, but then they did some more research. They came back and they told me I had something called a spontaneous coronary artery dissection, where basically there's no underlying cause or root to why it happens. It's just one of your arteries randomly tears. And when it tears, it can fall over and cause the blockage. So I too experienced 100% blockage. However, when I told them that this was like weird, I said, well, at this point, if there's nothing you could have done to prevent it, I should have drank the alcohol and ate all the bacon. Because I was eating healthily, exercising, doing all the things that you are supposed to do to prevent health challenges. But I quickly learned that age doesn't matter and sickness is for everyone, including a heart attack. So that is the basis of my heart attack. And once again, it's called a SCAD. And I know that for me, I immediately wanted to blame HIV for it because of the prevalence behind having HIV and a heart attack. But each time I tried to blame it on that, everyone came back down to the root of there's no real root cause for that type of heart attack.
Thank you, Masonia. I know you were saying that you were living a healthy lifestyle. Were you ever diagnosed with any chronic conditions such as hypertension, diabetes, high cholesterol?
No, that's actually what saved me. The fact that I didn't have high blood pressure, high cholesterol. Those are things that run in my family. So I grew up with a very easy diet. I was a picky eater anyway. So there were a lot of things that I just stayed away from naturally because it just wasn't what I grew up with. But then after experiencing a heart attack, I was like, I'm going to eat whatever I want. And I did. And I'm paying for it. But because I did not have an extensive history is why they immediately asked me had I had a history of substance abuse or substance use. And they asked me if I had no high blood pressure, none of that. But one of the things that I was wondering if it was just the HIV meds or even my hormone levels. So I do know that I do have a past history of hyperthyroidism, which I know can lead to an enlarged heart and which can cause a heart attack. But my thyroid levels had been in normal range for at least 7 years by then, because when I was pregnant with my daughter, it knocked it out and I was able to get it under control for the last 7 years. And it's still showing that it's in normal range. But I still think that based on what they're saying for the type of heart attack I had, it happens to women mostly. About 80% of them are women. 70% of them were either pregnant or had recently given birth. And so I didn't fit the description or the stereotype around having a heart attack. So in a lot of ways, it got dismissed and still does.
Exactly. Thank you, Masonia. And Stacy, I know you talked about some of the chronic conditions you had prior to your episode. Did your doctors ever talk to you about your increased risk for cardiovascular disease?
Never. I never had any issues, even though cardiovascular disease runs in my family. My sister at the age of 32 had a heart attack on her way to work. But my heart attack came from, I was overweight, obesity, and I had weight loss surgery. And so I had to go in to have excess skin removed. And they removed the excess skin, but after about versus 10 days, they removed my drain tube after about 4 days. And so when they removed it, I started bleeding out. And so about a week after that, I had a massive heart attack. But they were trying to say, well, no, you have other health issues. And I got attorneys and everything, but nobody would represent me, for one, because of my HIV status. And they were saying, well, you're diabetic already. And you have this going on, you have this going on. So they kept trying to blame it on everything else that I'm living with. And so, just it's been a struggle. In and out of the hospital because I'm always having chest pains. I'm on all kind of heart medications on top of trying to control the cholesterol. And I've been a diabetic from the age of 8 years old, so almost 40 years. And, I just try to live day by day. And I've already had to change my diet. But before I went in to go have the surgery, I had a stress test done that said that my heart was perfect, that my heart was good despite of all the other health issues that I was going through. But, still right now today, they still often blame it on the fact that I'm a woman living with HIV, that I'm a woman living with diabetes, that I'm a woman living with hypertension and cholesterol issues. So they blame everything that happens to me on the fact that, hey, you got a lot going on anyway.
Wow. Thank
So
you.
it makes it tough.
Thank you. Wow. Can you guys kind of shed light on how often you were following with doctors prior to this event versus afterwards, so that we can kind of understand how your life has basically changed with this event?
I guess I'll start. So when you have an HIV diagnosis, it's like your healthcare goes under a microscope, and you're consistently being monitored on all levels, from your blood levels with your kidneys, your liver, the enzymes and so forth. And everything anti-inflammatory, making sure that you're just living an overall healthy lifestyle. And so I went from maybe seeing 2 doctors, my HIV specialist, and actually, and a therapist, a mental health therapist, for a while, to seeing about 5 doctors again, but and going to an appointment almost every week, to having a stress test done chemically, doing a lot of MRIs, doing a lot of CT scans, needing oxygen because my oxygen levels would drop because of the medications for the heart meds. I initially started with sleeping all day when I got home because I was facing heart failure for the first 4 months. They wanted to give it 4 months before they would call it heart failure, because they wanted to see if my heart was going to heal. And so within 4 months, I was deemed, no, I didn't have heart failure. So my, what you call ejection fraction, how many times my heart was beating per minute, had gone up percentage wise, but it was fairly low, and it could drop all the way to 35 in the oxygen range, even though, you're supposed to be at 100 for that. And my heart rate would drop to maybe 35 and 40 as well. So I struggled for the first, 6 months to a year, just with breathing and walking. I didn't realize that I needed a cane for a very long time, but shortly after I had the heart attack, the next year we had COVID, so everything was shut down. I really didn't need to leave the house for much. I can say that I was under a lot of stress because I needed a root canal at the time. And I was taking just one class, well, 2 classes, but one in particular, statistics, which will stress anybody out. And, but my appointments went from once every 3 months to all of a sudden once a week. Sometimes in the hospital once every other month, and still would go if I think something's wrong. But what I realized, Stacy mentioned it earlier, when I have my menstrual cycles, is when I experience the most chest pain. And I've been telling the doctors this for a while, but my common sense told me that, like, okay, well, if that's the case, it's the anemia. So my cycles are already heavy prior to the heart attack. They get even heavier after the heart attack. I missed 4 months of my cycle, 3 to 4 months of my cycle after the heart attack. I didn't have one. But then just paying attention to that, like realizing not only myself, but other women who had experienced a SCAD were saying the same thing, that they were experiencing more chest pain around their cycles, angina. And so I went and I talked to my HIV doctor and told her, hey, I know I'm anemic. We've known that, but can I get some iron infusions? So we started with that. And then eventually, because it all went back down and fleshed out because my cycles were still heavy, I went to a hematologist. I requested to see a hematologist to see if something else is going on blood disorder wise. And they didn't see anything other than my hemoglobin producing well, but not staying in the body long. So from there, I had to make a decision around looking at fibroids. And the fibroids was something that I was considering getting looked at before the heart attack, literally the week of. But I had the heart attack, so I couldn't focus on the fibroids anymore. I couldn't do any other surgeries or anything because my heart wasn't performing in a way where it would be safe enough for me to do it. But what we learned from that is that the scar tissue from the healing of my heart, the scar tissue that remained is what causes the chest pain because there isn't enough blood flow going through at times. So I refuse, even though they say it's okay, I refuse to go through metal detectors because I don't like the idea of it making me feel like I got electrocuted, because it takes me right back to the heart attack experience because of the level of pain that it serves for just a split second. But my entire life has changed tremendously since experiencing a heart attack. I would love to dance and skate again. I would love to bowl like regularly, not just a little bit and be tired afterwards. But I really, my life completely changed. I wouldn't wish this experience on anyone, and I would take HIV and all of its stigma 15 times over to never have another heart attack experience again, because that was awful.
You're my Shiro, you're my heart sister. It seems as if though our stories are almost exactly the same, because everything that you spoke about, I went through it and still go through it right now today. I cannot go into an airport and walk to the terminal. I have to get a wheelchair, because if I do, my heart rate goes real high and I feel like I'm going to pass out. So as far as doing the things that I used to do, I don't longer do anymore. And sometimes I just feel like I'm stuck in a rabbit hole. But even before I had the heart attack, I was went through a whole lot. As a child, I was a diabetic, so I had a lot of issues. And as I got older, the diabetes got worse. And then I was diagnosed with HIV at the age of 20. And then I was diagnosed with kidney disease. And then I was diagnosed with hyperlipidemia, which is high cholesterol. And then I was diagnosed with migraines. And so all this stuff and PTSD, when the hospital, that same hospital, took my baby's life because of my HIV status almost 9 years ago. And so all that has changed, but it seems like I go to the doctor even more, like 10 times more, double. I'm constantly in the doctor's offices. I go see my cardiologist every 2 to 3 months because I still have those aggravating chest pains. I go see my endocrinologist, which is my diabetic doctor specialist. I go see them every 3 to 4 months. I go see my kidney specialist every 6 months because my kidneys are doing good despite of everything else. So it hasn't really changed a whole lot because I was already going to the doctor a lot, but I'm going even more. And it's so frustrating from day to day. And it's so aggravating when I can look at my calendar and most days on the calendar, I have an appointment. And so it's frustrating. Then when I get stressed or get hyped up, I start having chest pains. And I was like, I said, you know what, Lord, just guide me and just be with me and just keep me through all of this, because someone needs me. I have an almost 30-year-old son. I have an almost 9-year-old grandson. And, I have brothers and sisters that love on me tremendously. I have PWN sisters. I have Masonia and Bonita and just a whole heap of brothers and sisters that rally around me from day to day. Every day of my life, I can get a phone call, I can get a message saying, sister, I love you. And as long as I can hold that in my heart, then my heart will continue to heal, and the love for my brothers and my sisters will continue to grow, and my heart will continue to heal and heal and heal and get stronger and stronger and stronger because of you all. Thank you.
Thank you. Thank you, ladies, so much for sharing your experiences with us and also kind of shedding light on the after effects of your cardiovascular incident. As a doctor, I highly recommend following with your primary doctor at least once a year for annual physicals. Usually during these visits, we like to screen for obesity, hypertension, high cholesterol, and even diabetes. If you're found to have any of these conditions, your doctor may start you on medications, to either treat those conditions or decrease your risk of cardiovascular disease. We also use that time to help counsel our patients on healthier diets, exercise, and options on helping to stop smoking and alcohol use. Lastly, ask your doctor about cardiac calcium scoring. So this is a relatively new screen for coronary heart disease, where they take an image of your heart and the blood vessels of your heart, and they look for calcified plaques, which is just buildup of cholesterol that have calcified in your arteries. And it's supposed to help predict your future rate of heart attacks. And so again, this is fairly new within the last 5 years. But just discuss with your doctor and see if you are a good candidate for these interventions. Now, for prevention of cardiovascular disease, diet and exercise are very important. When we talk about diet, we're talking about reducing your salt intake, limiting your carbohydrates, which contain breads, pastas, rices, limiting your sugar intake, so watching your juice, your soda intake, but also fruits. Beware that fruits do have natural sugars, and sometimes they are good for you, but excessive fruit is not healthy. Increasing your water intake, water can help you feel fuller and curb your appetite. And then overall, just watching your portion sizes and calorie intake. For exercise, it's recommended that everyone does at least 30 minutes of exercise 5 days a week. If you're already active, increasing your intensity can be beneficial, versus if you're someone who is not really active, you can easily get started by decreasing the amount of time that you spend sitting and increasing your steps. And then lastly, decreasing tobacco use can significantly decrease your risk for cardiovascular disease. This includes smoking cigarettes, vaping, and using any other tobacco products. I did link a phone number in English and Spanish that helps people with quitting smoking, but also talk to your doctor because there are medications that can help you as well to cut down on your tobacco use. Next, I also provided some resources from North Carolina. These are 2 North Carolina databases where you can enter your zip code and they'll show you all the resources in your community, including programs that help with smoking cessation, nutrition education, walking programs, and other recreational activities in your area. And lastly, I included some mobile apps that can help you not only track your diet and exercise, but they also offer healthier meal options and exercise regimens, regardless of if you're new to working out, new to dieting, or if you've been doing this for years. Thank you. Do we have any questions?
I believe most of the questions were answered during the presentation. I'm going to say thank you so much for sharing your experiences and being willing to talk about your journey. I think we all learned something very important today. We will be dropping a link to a program survey. So if you would feel obliged to fill that out for us, that would be great. We encourage everyone to sign up for SOH Time and follow us on Facebook and Instagram for updates on upcoming webinars and join our mailing list for future updates. Our next webinar is a National Women and Girls HIV panel discussion on March 17th. So look out for the registration that's coming out soon. And additionally, every 3rd Wednesday of the month, we hold a hybrid group meeting for Black women living with HIV from 5:30 to 6:30. I will drop the contact information in the chat for those who are interested in joining that as well. And just thank you so much, everyone, for coming and sharing their stories and participating today.